Pay attention, the endoscopic lift, using this method, particularly when it involves the center of the face, can substitute for blepharoplasty, or, in summary, it's a repositioning of the eyebrow, referred to as a brow lift.
Obvious that the diagnosis is crucial here. Unfortunately, I often witness patients coming to my office frequently. Individuals often seek eye examinations following blepharoplasties, despite the true concern being the drooping of the eyelids. So here, the surgeon's diagnosis is extremely important. If there is protruding skin on the upper eyelid, it is known as dermatochalasis. This condition can cause excess skin on the lid. In this situation, blepharoplasty is appropriate due to the actual excess of skin. But be careful because this is less common than you might think. Frequently, the skin covering your eye is not derived from the eyelid skin. It is typically influenced by two factors. Its total length is around 128 characters, resulting from the lowering of the eyebrow and the reduction of volume in the upper eyelid fold. So, if the reason for the heaviness of the upper eyelid is caused by the descent of the eyebrow or the emptying of the eye socket, clearly having a blepharoplasty is not the ideal or recommended surgery. But from an aesthetic standpoint, it creates an effect, which is the opposite, as it does not beautify the gaze. However, it does not create a lifted appearance, resulting in a deep-set stare that makes one appear even more aged. Here's a straightforward illustration. When you observe a picture of a youthful girl, you'll notice that she possesses a plumpness above her eyes. If you sadly observe your grandmother's eyes, you may notice an unmistakable emptiness within them. Therefore, when we engage in the surgical procedure that excavates the eye socket, we are not enhancing its properties. Rather, we unfortunately induce a specific imperfection, which is referred to as iatrogenic, meaning caused.
From a surge.
That is exactly right.